Hi, I'm Rihanna Faith, and I'm here to tell you a story. Today's a little less of a story and more of a PSA, a public service announcement, something that I feel really strongly about and just want to, or feel pressed to share. So yesterday, I happened to be at a funeral for a young man who's 38, and and prior to going to the funeral, I had had a conversation with a gal that I know. She was going to a funeral the same day, and we were just talking about, having sort of things in order. And I was talking about the importance, from my perspective, of normalizing critical conversations with your family members around things like what you intend to do with your stuff, having a will in place, having an advanced healthcare directive, who's going to make decisions for you, what decisions do you want to have made, a trust if you have anything that's appropriate for that purpose. And, most people do have something. And then really most important of all of this is having critical conversations with your families. And so this was something that I had mentioned prior to my surgery, and a conversation that I've had with my kids numerous times. And then it spawned again. My sister and I recently read a book, and in that book, a main character, well, the mother of the main character, has dementia, and it was an early onset, in her 50s. And they had the discussion upon diagnosis, what does she want to have done? And she wanted to stay at home. And so the family all sort of rallies together to support her staying at home and caring for her. But it gets really hard, understandably. And there was really no discussion about at what point would they make the difficult decision, if necessary, to transition to a higher level of care beyond what the family members were capable of supporting while she stayed in the home. And so that spawned a whole new thought process for me of making sure to integrate that into my sort of version of the 5 wishes. And so if you've not heard of it, the 5 wishes is a national registry. They have resources on there for certain and various scenarios that you might face at end of life. What kind of care do you want? What level of medical intervention do you want? And it's a helpful tool, resource, because it asks questions with specificity that you might not have contemplated otherwise. And the reason why I feel so strongly about this, I was, one of my prior roles, I worked in clinical operations for a large healthcare institution in San Diego. And a part of my role was having these decision-making conversations, supporting the clinical team as they would elicit an ethics committee, chaplain services, and all of that when they need to talk to a family about next steps when a patient is nearing end of life. Who are the decision makers? Are they prepared to make those necessary tough decisions as far as withdrawing support or transitioning from active to support to palliative care, comfort measures, or hospice, whatever that might look like? And one of the things I thought the entirety of that role, because these conversations came up at least every other day. We had a number of hospitals and two skilled nursing facilities, as well as a health group. And so within that whole scope of locations and care environments, there were lots of occasions where there would be a patient without clear direction. The thing that I recognized over and over and over again is what a burden that puts on your family. And I don't mean that in any kind of callous or critical way, but if you have told your family, this is what I want, and you've put it in writing, then when they're faced with those decisions, they are not bearing the burden of guilt or worry that they're making the wrong call or taking some preemptive, premature action. They are equipped and empowered with the opportunity to honor your wishes. And that transforms the experience by a lot. So if your family member has said, here's what I want palliative care, I want I don't want to be sustained on life support long term. Just move me to palliative care and hospice if necessary. I'd like to be in the home, or if there's no hope of recovery, I'd like you to just withdraw support. That family, while they may be grieving the loss that is about the impending loss, they are not also grieving having to be the one to make the decision, because you already made that decision for them and you communicated it with them and you documented that decision. And again, that is transformative for the family. So the families who had those documents in order, we rarely got called on those, but there would be times where the nurses would share or the clinical teams would share what a relief it was for them also, because there are like no people in healthcare who are there looking to push someone to make that tough call, right? They're there to save lives and care for people when they're at their worst and in a terrible state. They don't want to be a part of pushing, or the perception of pushing someone to make those decisions when they're not ready. But it impacts the grieving process, in my observation, when the person or the family members are having to make that call for them. And so in very personal situation, my dad, when he was gravely ill, and he had been sick for a long time, and I had asked both of my parents, so Mom, this is your reminder, please do this. But I'd asked both of my parents when I was like 19 or 20, I started my paralegal program, and one of my classes was estates, wills, and trusts. And so I had put together my will and trust and an advanced healthcare directive, and I provided it to my family. And I remember my parents' reaction, because again, I was 20 at the oldest when this happened, and they were so upset. My dad in particular was unraveled. I can't believe you're talking about this. This is so upsetting, so morbid and macabre. Like, why? Why do we need to talk about this? It's not necessary. And I was really kind of terse in my response. No, this is necessary. This is responsible. I have a child. I want all of what I expect for me, for her, to be outlined so there's no confusion. Nobody has to go through some frustrating process because they're not sure what I really wanted or what my wishes were. So I asked and asked and asked, and my dad, huge on avoidance. And again, I love my dad dearly, but he was not good with dealing with things. So he did not want to have these conversations. We'd talk about anything, but anything that was like plausible, legitimate, emotional, that would not be territory he would embark on. You talk about other emotional things, but this was avoid. And so when he was in his final year of life, he had become quite ill, and he was continuing to have these intermittent emergency department visits, trying to get some relief from the advancement of illness. And I just so happened to be coming up for a visit because it seemed like he was getting quite a lot worse. So I had gone up for a visit, and as I arrived, my mom was picking me up from the airport, and she says, your dad's actually just been admitted to the hospital. And I don't know that I knew he had even gone into the ED, because I think it happened sometime while I was mid-flight. And I said, what's he going, what do you mean they admitted him? Where is he? Well, he's in the ICU. I said, well, what's going on? Low blood pressure. Well, it turns out there was suspicion that he might be in septic shock. He had ascites, and they kept trying to draw the fluid off of his liver, or out of his abdomen, because his liver was failing. He had cirrhosis from drinking, this self-destruction for years. And at this point, they were worried that he might be septic. So his blood pressure was low. He had a fever. He was not in good shape, and he had disorientation. So it was a mess, kind of all around. But on top of that, he didn't have any of these documents in order, despite my repeated and honestly somewhat obnoxious asking this to get done. And so he deteriorated rather quickly. They tried to his kidneys started to fail, so they tried to do dialysis. But each of these different points, my mom was having to make the decisions as his first closest decision maker, the spouse. And my mom was burdened with, well, what should I do? And I don't really know what he would want, and I'm not sure how far this should go. And she had the dialysis started, and then the dialysis failed. He kept getting blood clots. And so there came a point the next day, the family came together, there was a conversation with the doctor, and I was kind of relentlessly reading all of the results and saw sort of the writing on the wall. His liver was failing. He was not a good candidate for a transplant that had already been evaluated weeks before or months before. And now his kidneys were failing. His kidneys were failing because his liver had failed. And so now he's got 2 organ systems that are just over it and done. And the doctors brought in the family. We got everybody there as quickly as possible, and we're having the conversation, what are we going to do next? And what was such a shame is that we would have still had that conversation with the doctors saying, we feel like it's time to transition to palliative measures. If my dad had had documentation in order that said, I don't want to be unnecessarily sustained on life support when there's the hope for recovery doesn't exist, that wasn't an option because we didn't have that. And so it became kind of a heated discussion with the family. And I felt strongly that it was somewhat cruel to keep my dad in that state of support when the recovery wasn't happening. He was in pain from his abdomen being quite distended with fluid, and but everybody was grieving this transition because we'd been through this situation with my dad a lot of times where he'd have medical events and things that would come up that seemed like surely he's not going to make it. I mean, he was in a motorcycle accident and he had all of these complications, a fractured kidney, a page kidney. It was really bad. We thought, are we going to lose him? It seemed like a possibility. And what happened? He recovered. And so as we were facing this situation and the doctors are saying our recommendation is to withdraw support, move him to palliative measures, comfort care, I think it was hard for everyone in the family to sort of embrace that, like, this is actually, that will be the outcome that he's going to pass. And all of this, well, not all, because it was still, we were all still grieving this transition to a situation we really didn't want to deal with. But a lot of the emotion amongst each other or at each other could have been eliminated if he had made clear in writing and had discussions with us about what his desires were, what his preferences were. And I think people put this stuff off believing, well, this is something that'll happen when I'm, 80, 90 years old. But the truth of the matter is you never know when something could happen. I mean, there was a situation that I was a part of where a woman was in a car accident. She was pregnant, and it wasn't clear who should be the decision maker because she was married but separated from her husband. And the baby she was pregnant with was from her boyfriend. So the boyfriend is desperately asking if she's not going to make it, then at least sustain her until the baby's born because this is his child. And the husband, who is the legal decision maker because there's nothing that says otherwise, is saying, I don't think so. I don't want this baby to exist, and I don't need her to stay on here. She didn't want to be on life support. And we're all in a quandary because there's a clear conflict of interest with the husband who, she separated from. So we had to engage ethics committee and all the rest of this. And I just kept thinking, what a disastrous situation for, the boyfriend, father of the baby to be in, where he has no rights or no say. There was nobody else who had any idea. And she was in her early 20s, and so mid 20s, whatever. But nobody's thinking about that stuff then. So I guess my recommendation, my strong urging, don't wait until you're in some dire state, and don't wait until you're so much older to have these conversations. Have them now. It doesn't matter how old you are. Also, organ donation. Yes, you can select when you're a driver whether or not you want to be an organ donor, but have those conversations because not everybody wants to be an organ donor. I'm absolutely such a fan of organ donation. I'm a huge supporter of that, live and deceased organ donation, but that's not for everybody. And so my family knows I don't need anything. They're all spare parts. I don't need them anymore. Give them away. If anybody can use anything or benefit from any of it, give it to them. And then, like, what do you want for after you pass? Do you want to be buried? Is there a place you want to be buried? Do you want to be cremated? What do you want the disposition of your ashes to be? Do you want family members to keep them, or do you want to spread them somewhere? Like, what does that look like for you? If you have these discussions, if you make the decisions, like, really, I just cannot stress enough, have also the discussions with your family members, so then they can come to terms while they can still converse with you about this. So when I had this most recent surgery and I was reminding my oldest by phone, what my wishes are and all of that good stuff, she said, I'll follow whatever you ask for unless you say you don't want to be resuscitated. And I was like, my gosh, what are you talking about? Like, I don't have any fatal illness or like any other reason I wouldn't pursue reasonable care. And she's like, well, I'm just telling you, if you DNR, I'm not going to agree to that. I'm not going to support that. And so, but we could have that conversation. Can you imagine if I had that in writing that I wanted to be DNR and my daughter didn't know? She's outright telling me, I'm going to ignore what you asked for, Mom, because I don't agree. But because we had the conversation, and again, not applicable, but because we had the conversation, I could then weigh instead or make my case more transparently about why I felt that was necessary or why I didn't want to pursue resuscitation if that was the case. But it's a gift. It's literally a gift you give to your family. And I am confident that I'm sure there's somebody, but I'm confident that the vast majority of people do not want to leave this earth having their last acts on earth be burdensome to their family by way of putting them in a position to make really tough decisions sort of blindly, not being confident in what their preferences would have been. And so do your family a favor. This is a gift of truly epic proportions. Put it in writing, have the conversations, a will, trust, advanced healthcare directive, 5 wishes if you haven't contemplated that already. Have the conversations, make it so normal, right? Because death is a part of living. It's going to happen to all of us, death and taxes, almost tax day. So don't put it off, get it in writing, have the conversations. I cannot stress this enough. It's a very loving gesture to do this, regardless of how hurt your family might be by the opening up of these conversations, but really doing it while there's nothing else on the table, no critical illness, no upcoming surgery. I mean, it normalizes at a level that is really valuable because you need your family to be proper patient advocates. And when you can't make those calls on your own, they get to step in. And so equip them with the information they need to do that well. Anyways, I hope that's not too dreary for anyone. Again, I find it really valuable to normalize these topics because they do happen to all of us. And I had kind of a lengthy conversation about this on the way to the funeral about how important this is. And I really, like, if I could campaign something like on a public platform, like this is what it would be. Help people in your family, love them enough to tell them what you want and what you don't want, so that they can step in and advocate for you well without the emotional burden of it being their decision. I hope that makes sense. Anyways, if you'd like more information about any of those resources, I'll drop them in the comments. But come back again. I'll tell you another story. I promise it won't be so heavy. Have a great day.